Hey everyone, and welcome back to MedInkDiaries. Today our topic is meninges and dural venous sinuses. So meninges are basically the brain coverings. Like brain is protected by the means of these meninges, and these meninges is made up of three main layers. One is the dura mater, arachnoid matter, and the pia mater. The dura mater is the most superficial layer, or it's matter. Matter basically means mother. So this dura mater, and dura means stuff, so it who mother is someone who protects her child, so this mother comes from that part, like it protects the brain. So the dura mater, arachnoid matter, and the pia mater comes from that thing. Now the dura mater, it's made up of two layers, periosteal and the meningeal layer, and it also forms dural septa, dural venous sinuses. Then the arachnoid matter, which is in the center or the intermediate layer, it contains the subarachnoid space, and it forms the arachnoid granulations. And finally, the most deepest layer is the pia mater. Okay, next here is this is a sagittal view showing the scalp, the hair, the scalp layers, then the bony layer, then the meninges and all the layers, and the brain over here. So you can see here, this is the meninges layer, and first over here you can see this dura mater. This dura mater runs here and splits into the periosteal upper and the inner meningeal layer over here. And here in the center, in this blue color, it forms the dural venous sinus, and this thing over here, it's the dural septa. So this dura mater, as I told before, it means tough mother, and it is the outermost layer of the meninges, consists of two layers, periosteal and the meningeal layer. Now these two layers, initially these are bound together, but as soon as they form the dural venous sinus, these splits and divide into the upper periosteal and inner meningeal layer, and also forms the dural septa along with the dural venous sinus. Next is the arachnoid matter. Here you can see in the purple is the arachnoid matter. It is the intermediate layer. It means spider-like, spider web-like. You can see here it's a spider web-like, and it surrounds the brain and spinal cord. Like it's filled with the cerebrospinal fluid. So it's an important feature of the arachnoid matter, that it's filled with CSF. And these are the arachnoid granulations. Over here you can see these feet like something. These are the arachnoid granulation. These consist of the cerebrospinal fluid, and this cerebrospinal fluid is then transported from these granulations into this dural venous sinus. So it's exchanged over here, and this arachnoid matter is thin, delicate, and avascular, impermeable membrane, like it doesn't contain any vessels. Now inner to this arachnoid matter is the pia matter over here, which is vascular in nature. As you can see here, the veins and arteries over here. This is the artery and this is the vein. So this is the pia mater. It's a thin, delicate, and highly vascular membrane, innermost layer of the meninges, and also it closely follows the surface of the brain. As you can see here, it's covering the brain closely, and if there is spinal cord, it covers it also, and also covers the gyri and the sulci. Gyri and sulci are basically the folds and grooves of the brain. Okay, next is dura mater. It's the same. It's basically a more enhanced diagrammatic view. Over here you can see it's the same points written as I told you before. Here this is the dura mater, a single layer. You can see here basically two membranes, two layers bound together, but you can see a single layer over here which splits into two, upper periosteal and the inner meningeal layer, and forms this dural venous sinus, this triangle shaped, and this is the dural septa. This is the brain. So next is dural septa. Dural septa are basically these are folds in the brain that restrict the displacement of brain, much like a seat belt. Like they hold the brain in position and prevent their side to side movement, and like a seat belt fixes all things in one place, doesn't let them move. So the dural septa function is same. Now here we will discuss three dural septa: falx cerebri, tentorium cerebelli, and the falx cerebelli. So the falx cerebri is a sickle-shaped vertical fold. You can see here this sickle-shaped fold, this hole. This is the falx cerebri. Over it here is the skull bone, and this is the falx cerebri. It's vertical and a sickle-shaped fold. This separates the cerebral hemisphere. For example, this is the left cerebral hemisphere and this is the right cerebral hemisphere, as you can see if you see from an aerial view. Then in between these will be a vertical sickle-shaped fold known as the falx cerebri, and this basically prevents the side-to-side displacement of the cerebral hemisphere. Now anteriorly it's attached to the cristogalli, and superiorly it's related with the superior sagittal sinus. We will discuss it later. The dural venous sinus known as the superior sagittal sinus is over it, and below it is the inferior sagittal sinus, and posteriorly it becomes continuous with the tentorium cerebelli. This horizontal fold is the tentorium cerebelli. Okay, next the tentorium cerebelli. Tentorium cerebelli is also dural fold. It's horizontal and it separates the cerebrum or the occipital lobes from the cerebellum. So this is the falx cerebri, and this horizontal fold over here, this is the tentorium cerebelli, and it separates the cerebrum over it from the cerebellum below it. So it's a crescent shaped fold. And the last is the falx cerebelli. Over here you can see this small fold over here. This is the falx cerebelli, and it's located between the cerebellar lobes, the cerebellum, between like two lobes of the cerebellum. Okay, next is dural venous sinuses. Dural venous sinuses are endothelium lined venous channels located between the periosteal and the meningeal layer of the dura mater. As we saw before, the dura mater, it was first of all it was a continuous layer, like two layers was bound together, but as soon as they formed these dural venous sinuses, it split into two layers named as the periosteal and the meningeal layer. So these dural venous sinuses, these are basically endothelium lined venous channels, like it contains a venous blood and located between these two layers of the dura mater, and it contains the venous blood. No valves are here, no muscles, and it receives blood from the brain, orbit, skull, and the internal ear. Now the major sinuses located in our brain are this superior sagittal sinus, this inferior sagittal sinus, this straight sinus over here, the right and left transverse sinus, this confluence of sinuses where all these meet, the sigmoid sinus, and an occipital sinus is also located. I haven't drawn here, but there it's located, and the cavernous sinus, which is present lateral to the sigmoid, not sigmoid, sphenoid bone, yeah. So it's located, and the right and left cavernous sinus are like connected via the intercavernous sinus. Inter or intra, I don't remember, but there's something. Yes, intra cavernous sinus. Yep. Okay. So now we talk about the dural arterial supply, like what's the arterial supply of the dura mater. So this dura mater, it's supplied by the branches of the internal carotid artery, maxillary artery, ascending pharyngeal artery, vertebral, and the occipital artery. Very easy to learn. Like you can learn the mnemonic like IMAVA. So IMAVA would be the mnemonic named as I for internal carotid, M for maxillary, A for ascending pharyngeal, V for vertebral, and O for occipital artery. Now most important artery over here is the middle meningeal artery, which is a branch of this maxillary artery, and it enters the cranial cavity via the foramen spinosum through the infratemporal fossa. Now this middle meningeal artery is the most commonly injured artery in the head injuries, and like for example, if someone is hit hard on the head side of the head at the terion point, this middle meningeal artery is most likely to get injured, and the blood comes out of it, and it can cause epidural hematoma. So it's a very serious clinical, you should remember, very important. Now lastly we talk about the dural nerve supply. The dura mater has a very rich nerve supply, and it's mainly given by the trigeminal nerve, vagus, and the first three cervical nerves. And this dura is very sensitive to stretch. For example, if it's prone to, like, if it's stretched, then it causes pain, which basically causes the headache. And above the tentorium cerebelli, the sensory supply is given by the trigeminal nerve, and then the pain is referred to skin of the same side of the head. Now below the tentorium, sensory supply is given by the greater occipital nerve. Now below the tentorium, the sensory supply is given by the greater occipital nerve, and pain referred is to the back of the head and neck. Now important viva point over here is that normally the meninges surround the brain, but like this is the brain over here, and the optic nerve is basically an extension of the CNS toward the eyeball. Like in cartoons you also see that sometimes if there is a bare brain, you see the eyes come out of it through the optic nerve. So that's basically, the optic nerve is basically an extension of the CNS toward the eyeball, and as these meninges surround the brain, these meninges also continue around the optic nerve. So this dura mater, the arachnoid mater, and the pia mater all surround this optic nerve. So that means the subarachnoid space, the CSF filled subarachnoid space also extends from this cranial cavity towards the eyeball along the optic nerve, and it continues up to back of eyeball. So it's clinically important because if the intracranial pressure rises in the subarachnoid space around the optic nerve, it can cause swelling of the optic disc, which is known as the papilledema. And physicians they use the ophthalmoscope, I guess that's known as the ophthalmoscope, and they use it to detect whether there is increased intracranial pressure or not. It can cause they see that the optic disc basically it is seen, and we can detect the papilledema, which is a classic sign of the increased intracranial pressure. So that's all for today, and I hope you like my lecture, and don't forget to like, share and subscribe.